This video will demonstrate fully arthroscopic Latissimus Dorsi transfer for irreparable Posterosuperior massive rotator cuff tears. We have nothing to disclose. The patient was placed in beach chair position. The superior pec major portal, inferior pec major portal, anterior axillary portal, and posterior axillary portal were designed to release the Latissimus tendon. After arthroscopic examination, the massive rotator cuff tear is confirmed to be irreparable. The Latissimus transfer is indicated. The dissection is performed posteriorly. The axillary nerve was exposed. Dissection is continued medially and inferiorly to show the vertical fibers of the long head of triceps. Release is continued until the supramargin of teres major muscle is visualized. The scope is placed in the portal B and electrocautery is introduced from portal A. Release along the surface of teres major to Latissimus muscle. Then the scope was placed in portal D. The three sisters are showed and the upper border of the pec major was identified. Then the superior pec major portal was established, and the anterior axillary portal was also established. A switching stick was used to expose the Latissimus dorsi tendon. The scope is placed in the superior pec major portal. The upper border and lower border of the Latissimus dorsi are exposed. Great care is taken to prevent any injury to the axillary nerve and the radial nerve. The connections between Latissimus dorsi and the skin can be released. The fiber band between the inferior border of the tendon and the long head of triceps must be released. The insertion of Latissimus is released from the humeral shaft. Be careful to separate Latissimus and teres major muscle, because their muscles are adherent on their dorsomedial edges, and the connection should be released. The release should be performed to the posterior axillary portal, and the pedicles to the Latissimus can be seen. The posterior axillary portal is enlarged to 2 cm, and the Latissimus tendon can be easily retrieved out of skin and weaved with autocut sutures. A grasper with PDS2 suture is used to bring back the Latissimus tendon through the posterior pathway. The tendon and sutures are fixed to bone with 2 knotless anchors. The incision is less than 3 cm. Thanks for watching.